ay isinalang na for genome sequencing. So, pre-process ngayon, we might have results by tomorrow or on Wednesday.
Thank you, ma'am. Next question po from Jonah Giolagon of Asahi Shimbun. How often do we test direct contacts of COVID positive cases or those under observation or quarantine to see if they contracted the virus? In the case of the Philippines, first UK variant case especially, information from a Pinoy nurse in the UK said that their direct contacts are tested 5 times on the 1st, 3rd, 5th, 12th, and 14th day, and some cases really take long to test negative. Ma'am?
Okay, dito sa atin, we follow the omnibus guidelines no, on the PDITR strategies, and we say that all close contacts, no matter if you're a close contact of the variant case or is a close contact of any positive patient, we test them on the 5th day from the last day of exposure para mas timely yung ginagawa natin test, mas magkaroon tayo ng basis no, kung positive talaga sila o hindi. Yung ginagawa sa UK, I don't think our resources would be able to do that, no? But the safeguard of our country would be that lahat naman po ng nagiging close contact, no? Especially ngayon at naka-identify na tayo ng variant, ay talagang ginawa po natin yung facility-based quarantine, or if home quarantine, we ensured na compliant sila sa conditions ng home quarantine, and they will strictly comply with the 14-day period of this quarantine. Etong pagtetest for longer periods of time, sometimes baka hindi na rin siya maging accurate. Kasi alam natin na may mga tao na kahit na nakalakpas na sila ng 14th day, positive pa rin sila because naiiwan nga yung mga minsan may remnants of the virus na nadidetect pa rin ng RT-PCR. So pag tinignan natin yung CT values nila, ang taas, more than 30, hindi mo pa rin yan ma-sequence kasi nga gano'n na yung state ng kanyang disease, no? Andun na siya sa recovery stage. So sa atin, ito pa rin yung sa atin yung sa omnibus guidelines ang ating pinapalo.
Thank you, ma'am. Next question po. Since travel restrictions have been imposed in connection with the new COVID variant, how many Filipinos have arrived, tested, and quarantined in Manila from those countries?
Well, we have a recorded number coming from the Bureau of Quarantine. We are still trying to consolidate all of these numbers because as you know, BOQ, meron pang ibang units of government that are also working together with BOQ. But as of this time, what we got was the 9,950 total arrivals from all of these restricted countries. So itong via air was 9,611 and via sea was 339. So we will be posting in our Viber group yung more complete details plus those quarantine status of all of these arrivals.
Thank you, ma'am. Next question po from Codep Moconseriaco of the Business Mirror. Some healthcare workers said they will refuse to take the COVID-19 vaccine. How will this affect the DOH education and awareness campaign to encourage people to get vaccinated?
Actually, we are having the town hall meetings, no? We started off last week. And during the town hall meetings, we have this poll survey na ginagawa, parang bago tayo mag-umpisa ng town hall, tapos pagkatapos. And we have observed, no, that at the start, ang sagot ng mga participants, no, like last week we had medical societies and then we had the nurses last Saturday. Halos pareho lang, no, ang resulta. At the start, mga 60 plus ang magpapabakuna. But during the survey, after nung lahat na nagbigay ng mga presentations, tumaas from 80 to 85%. So we can see really that information is really vital ito sa ginagawa natin. We have to explain properly to our healthcare workers and our other priority population itong ating bakuna, itong mga bakuna na parating, how safe they are, and what would be the benefits for a person or the population kapag ka nagbigay tayo nitong mga bakuna na ito. So we are trying to intensify our efforts in disseminating information, explaining to everybody. We have a series of meetings with the local government so that we can mobilize them to provide information also across the community. We have requested already the medical society, especially the medicals, yung mga specialista diyan. At alam natin na ang tingin sa kanila ng mga tao, 'di ba? They have high regard for these physicians. So hiningi natin na maging champions natin sila so that they can spread information. That's why they were the very first na ginawa natin for town hall. As well as with the Nurses Association kasi alam natin na talagang yung coverage nila ay malaki at sana makatulong din po sila sa pagpapalaganap nitong information that the vaccines that we will provide would be safe and it's going to be effective para sa ating population.
Thank you, ma'am. A number of the reporters are asking with regard to deaths reported in Norway. Let me just read the question, ma'am. From Mark Fetalco of PTB4, the authorities in Norway are investigating the deaths of 29 people who received Pfizer's COVID-19 vaccine, while about 13 people in Israel have experienced mild facial paralysis after also taking the said vaccine. Ano po ang reaction ng DOH lalo't meron ng EUA ang Pfizer vaccine sa bansa?
Unang-una, Mark, kailangan natin ilagay yan sa konteksto. No? If you try to read the entire article for this Norway issue, sinabi doon mismo, di ba, na pinag-aaralan maigi ng Norwegian authorities yung nangyari. Pangalawa, nandiyon na sila doon sa mga setting nila na premise setting na unang-una, binigay ang bakuna dito sa mga critically ill sa isang facility. No? And pangalawa, sinasabi nila that in a given time, they have reported 400 cases of deaths among this specific sector of the population. So parang sinasabi nila that this might just be coincidental because the patients are severely ill and baka kahit yung minor lang na reactions dun sa bakuna ay nakaapekto sa kanila. That's why it led to their death. But still, they are not closing the issue. They would want to look into it further. Pero sa ngayon, sinasabi nila, they don't think it's related, no? Pero of course, studies have to be done so that we can be able to validate at masasabi talaga kung yan ay may causality o talagang epekto ng bakuna. So ang sabi naman ng ating Food and Drug Administration with this kind of occurrences, pinag-aaralan yan, no? And Pfizer have to submit to the Philippine Food and Drug Administration a report regarding this matter. And once we evaluate the report, no, at base dun sa kanilang conclusion, that's the time that the Food and Drug Administration can decide on the EUA of Pfizer here in the country. So for now, hanggang wala pang malaking sufficient evidence, no, to say na talagang yan ay caused by the vaccine, tayo po ay status quo pa rin dito sa ating binigay na EUA ng Pfizer.
Thank you, ma'am. From Sheila Chrysostom of the Philippine Star, a January 16 Lancet report showed that while long-term effect of COVID-19 is not yet known, patients in Wuhan who recovered have suffered from 6-month consequences such as fatigue, muscle weakness, and sleeping difficulty. Has this been seen among patients in the Philippines?
Meron tayo, Sheila, no, mga anecdotal, mga reports. Meron silang long-term headache apparently. Yung iba nagsasabi yung parang lagi silang pagod na pagod. Yung iba naman nagsasabi na may pain sila on this part of the body after having it for so long already. But these are all purely anecdotal, no? Pero pinag-aaralan na po ng mga specific societies, no, dito sa country. Ito pong mga sinasabing long haul ng COVID na ito. And we will provide information kapag meron na po tayong mga resulta nito.
Thank you, ma'am. From Greg Gregory of TV5, while the government has tapped a number of private institutions for cold storage, the Cold Chain Group asks the government to coordinate with them as an association to recognize rules restrictions. May we get the DOH reaction on this?
Well, unang-una, ang mga third party, no, na itong mga private institutions for cold storage are going to have this kind of agreement, no, with the government. So, yung ating gagawin ay kailangan nilang sumunod sa mga proseso at protocol ng gobyerno. Kung sakaling meron po silang mga rules and restrictions during the time that we are negotiating, sasabihin nila yan sa atin. At sasabihin din sa kanila ng gobyerno kung ano ang pwede at hindi na ma-adapt ng Department of Health o ng buong gobyerno ng Pilipinas. Pero basically, lahat po na magsusupply sa gobyerno has to follow and to abide with our existing laws in the country, and specific to procurement, meron tayong RA 9184. Lahat po yan dadaan sa proseso, and lahat ng supplier na yan, kung interesado po sila, has to abide or comply with the protocols and provisions in the RA 9184.
Thank you, ma'am. A media partner is asking, ano na ang susunod na process after isumite ng Red Cross ang sample ng saliva test results para sa pilot study nito? Also, gaano katagal bago ma-verify if pwede nang gamitin ang saliva test for COVID-19 detection?
Yes, no? So, katulad ng sabi natin, tinatapos nila yung study and nakipag-ugnayan tayo sa kanila. Supposedly, Monday ang pagpe-present nila sa ating laboratory experts panel, but they asked for more time. They said that Wednesday na sila magpe-present sa ating lab experts, no? But they were already done with the study. They are just finalizing the analysis. So, pag-present po sa lab experts panel, and it is acceptable, isasubmit na po natin yan sa Health Technology Assessment Council para makapagbigay din sila ng recommendations. And in parallel, the Philippine Red Cross should be able to register already their testing kits na ginagamit for this saliva specimen, no? Para sa test ng RT-PCR sa Food and Drug Administration. Kasi dalawa po ang kailangan. Kailangan ng FDA-registered testing kits for this saliva as specimen for RT-PCR. At saka ang pangalawa is the validation study that will be acceptable so that we can adapt the protocol already. If all of these are there already, acceptable, may FDA registration, agad-agad po magagamit na natin yan. We can draft a protocol so that the other laboratories can also apply this.
Thank you, ma'am. From Red Mendoza of the Manila Times, Senator Angara said that the DOH daw was the source of the vaccine pricing na nilist niya. It was given daw po during the budget hearing. Does it constitute a violation of an NDA? Or ano po ang explanation why the DOH gave this pricing of the vaccine?
No, Red. This is not part of the confidentiality disclosure agreement. Kailangan natin balikan, kailan po ba yung budget hearing namin? Matagal na ng panahon yan. So during that budget hearing, we had to get the market prices, that posted in the internet and the specific websites para makakuha lang kami ng estimation magkano ba kakailanganin ng gobyerno para makabili tayo ng mga ganitong bakuna. So these prices that were posted, ito po yung of course kinuha ng ating legislators kasi nga po galing naman sa official source DOH. Pero ang tagal na po nung panahon na lumipas and we are already undertaking specific negotiations with different manufacturers. So ito po, may mga negotiated prices na lumalabas. So yung atin pong unang pinost was because we needed an estimate for us to draft our budgetary needs for the vaccines when we had our budget hearing. And these were all sourced from manufacturers' website or di kaya yung nakapost sa mga internet, no? Sa ano ba yan? Sa mga anong tawag doon? Basta I'm sorry. But these are market prices na pinost and we got it and we used it as estimate only. But now, just to be clear, meron na pong mga presyong negotiated na, no? At yan po yung mga naka-enclose dito sa CDAs ng bawat manufacturers.
That will be the last question, ma'am, for today. I will be going through the questions po submitted in the chat box. From Caroline Bongkin of CNN Philippines, the DILG says it can only rehire 15,000 contact tracers or 30% of the 50,000 tracers it hired last year due to budget constraints. How will the substantial reduction in contact tracers affect our surveillance?
Kailangan natin mag-adjust. So kapag maikli na yung kumot, dapat namamaluktot na tayo. Ganoon naman po tayo lagi dito sa ating ginagawang mga sistema. So unang-una, kailangan natin tandaan na ang local governments natin, meron naman talaga silang existing na contact tracers nila. Na katulong pa natin yung mga barangay health emergency response teams kung saan iba't ibang ahensya ang naipasok ng local government para mag-expand yung kanilang mga BHERTs. Okay? Ito pong hinire ng ating DILG are augmentation. So kung halimbawa po mababawasan, kailangan po natin mag-adjust, no? So there would be specific personnel na meron din ng local governments that they can, transition to become contact tracers hanggang inaantay po natin na magkaroon ng budget uli ang DILG and makapag-hire tayo ng contact tracers. Another one, LGUs also can augment for this budget so that they can rehire these contact tracers kung kaya naman po. Dahil napaka-importante po ng contact tracers sa ating surveillance system. kailangan po natin matuntun lahat ng nagiging contact nito mga nagiging positive cases natin so that we can be able to manage and prevent further transmission of the disease.
Thank you, ma'am. Next question po from Red Mendoza, related to the question a while ago. Bakit po hindi na-quarantine agad yung mga passengers from the Emirates flight? Di po ba dapat sila na-quarantine muna para hindi nahirapan sa contact tracing?
Well, during that time, Red, ang Emirates, no, ang UAE or ang Dubai, hindi pa sila kasama sa restriction. So lahat ng pasahero niyan ay nang dumating sila dito, they were complying with the usual protocol na kapag ikaw ay nag-test negative na, you can be allowed to go home and do your quarantine at home. So ganyan yung nangyari dyan sa mga pasahero niyang Emirates flight na yan. But just to let you know, no, in a matter of days, you were able to contact all of them except for 7 persons na talagang yung address and even the contact number ay hindi talaga namin mahanap. Pero bukod dyan, lahat yun, that 159, no? So we were able to do 152 and they were all swabbed, no, in a matter of days. So tama yon na kailangan talaga ma-quarantine para hindi na ganun kahirap mag-contact tracing. Pero ang magandang nangyari, we were able to mobilize our regional offices and they were able to locate all of these passengers. We were able to coordinate well with them. They were quarantined and also they were tested. So, 7 na lang po ang hinahanap. Tinutulungan na po tayo ngayon ni Mayor Magalong, no, from Baguio City para po magkaroon pa ng mas expanded na magte-trace nitong mga contacts na to. Nick?
Thank you, ma'am. From Aiko Miguel of UNTV, baka pwede po paki-ask din, what will be the HTAC's role on the vaccination plan? Will they be part of the evaluation of vaccines?
Yes, Aiko, no, it's part. It is an institutional part of the process of regulation in the Philippines. As you know, Universal Healthcare Act mandated that there should be a Health Technology Assessment Council that will be evaluating all the technologies that government will procure, no? Specifically DOH and PhilHealth kapag kagagawa ng benefit package. Kasunod doon, na bigyan pa uli ng another emphasis nung nagkaroon tayo ng bayanihan, no? Law, kung saan sinabi pa rin ng bayanihan law na bago tayo makapaggastos nitong pera na ito, kailangan merong Health Technology Assessment Council recommendations, positive recommendations. So itong dalawang to ay nakapag-institutionalize ng proseso natin dito. So what is its role? Ang ating ginawa na process, di ba? Ang ating Food and Drug Administration, as soon as may issue niya na yung Emergency Use Authority, papasok na yung proseso ng Health Technology Assessment Council. So ano ba tinitignan ng Health Technology Assessment Council? So ang Health Technology Assessment Council, aside from the safety and the efficacy, no, na meron atong mga bakuna na papasok, titignan din po nila yung social impact nito, titignan nila yung affordability, and titignan nila yung responsiveness sa equity. Pag sinabi nating equity, we are focusing on the vulnerable, we are focusing on the marginalized and disadvantaged. That is equity for government. Tinitignan din natin yung household financial impact. So lahat ng ito, meron silang parameters, clinical and scientific parameters, no? So they are comprised of different experts on the field of science, on the field of ethics, on the field of meron pa tayong mga epidemiologists, meron tayong mga anong tawag doon sa mga technologies, yung mga expert natin sa mga technologies and devices, meron po lahat yan. So they will be evaluating and then they give their recommendations to the secretary. Pag positive ang recommendation, we can procure the specific vaccine. So for this Pfizer, nag-meeting na po kami, nag-aaral na sila, matagal na, nakakuha na rin tayo ng mga dokumento na pinag-aaralan nila, and they will be releasing the recommendations to the secretary not later than Wednesday. No? So siguro mga Wednesday morning meron na yan.
Thank you, ma'am. From Cedric Castillo, update on the list of those who can't get vaccines aside from those 18 years old and below and those who are pregnant. Sabi ni Secretary Duque, may protocols daw po na binubuo dito. Ma'am?
Yes, meron kaming scheduled meeting with our National Adverse Effect Following Immunization Committee headed by Dr. Lulu Bravo together with our National Immunization Technical Advisory Group, together with the other experts, no, nakatulong ng DOH para pag-usapan po itong mga list of contraindications, list of precautions when giving the vaccines. Pero kailangan din natin malaman na nagpalabas na po ang WHO nung kanilang emergency use list recommendations for the Pfizer vaccine. At nakalagay po dyan specific yung mga pwede at yung hindi pwede. And doon po nakalagay ang tanging contraindication is severe allergic reaction to a vaccine or the vaccine components of the Pfizer vaccine. So ibig sabihin, yung iba po pinapayagan. But of course, there are conditions. Kailangan alam natin yan. Kaya nga sa mga pag-uusap namin with the experts, kailangan na-assess po ang mga pasyenteng medyo vulnerable bago sila mabigyan ng bakuna. So ilalagay po natin yan at kasama yan sa ating plan.
Thank you, ma'am. From Isa Umali of DCBB, may update na po ba sa number ng participants sa WHO Solidarity Trial? Kaya bang ma-meet ang 15,000? And may date na po ba kung kailan magsa-start ang trial?
Well, isa, kailangan mangyari yung 15,000 kasi yun yung protocol ng WHO, no? So, pag hindi nangyari yung 15,000, baka ma-delay pa yung paglabas ng resulta nitong trial na ito. So, we are trying to reach this 15 or required number. Kaya nga nanghingi na po ang DOST ng tulong sa ating mga local governments as well as dun sa ating mga medical societies para makakuha na ho tayo ng volunteers. Nag-uumpisa na tayo kahit hindi pa nire-release ng WHO yung final protocol at saka yung final date on when we will start. So that when they announce it already, we are prepared and we can very well start na itong solidarity trial. So titignan natin, no? Pero kailangan natin makompleto yung 15,000 na yan. Rolling naman to, no? Hindi naman yun at the start, meron ka ng 15,000. Hindi naman po ganon. So as you go along with the trial, dumadagdag ang ating participants.
Thank you, ma'am. From Erwin Aguilon, ang Cebu City in 1 week nakapagdala ng 316 na kaso sa loob lamang ng isang linggo. Bumabalik na naman po ba ang sitwasyon sa Cebu City nang pataas ang kaso ng COVID?
Well, actually, tumataas talaga, no, ang mga number of cases. Nung tinignan namin yung analysis natin, dito sa mga tumataas na mga cases natin ngayon, no, compared to the December, nakita natin wala siya sa NCR. Nasa labas siya ng NCR. At isa nga dyan, ang Cebu, na nakikitaan natin ng mga pagtaas ng mga kaso, no, in their specific areas. Aside from Cebu, meron pang iba. Meron tayong CAR, meron tayong Region 2, at marami pang ibang regions na nakakapagtala ngayon ng medyo pagtaas ng kanilang kaso at minomonitor natin.
I believe those are all the questions we can accommodate for today, ma'am. Your message po before we end today's forum.
Yes, Nick, no? So kailangan na ho namin magpaalam. Babalik po kami sa HOR na hearing. Nakaka-stream din naman po kayo doon, no? So you will hear the pertinent na mga detalye tungkol sa vaccination plan ng buong Pilipinas. So tinitiyak po ng Department of Health na hindi tumitigil ang pagkilos upang maihatid ang ligtas at epektibong bakuna para sa proteksyon po ng lahat. Mahalagang bahagi nito ang pagsisigurong nakahanay na ang bawat kilos ng national government, local government at saka private sector sa National COVID-19 Procurement Plan na nakalalayong maghatid ng dekalidad na COVID-19 vaccine sa bawat Pilipino. Sa planong ito, katuwang po natin ang mga experts ng Philippine FDA at mga independent expert groups upang suportahan ang mga benepisyo at pangmatagalang proteksyon na mayahatid ng bakuna. Sa kabila ng kaliwat kanang balita, alalahanin po natin ang halaga ng tamang information. Naway sama-sama po tayo maging responsable at sa pagbabahagi ng wasto at napapanahon na updates upang ang bawat isa sa atin ay magabayan tungo sa kaligtasan. Isa-isip po natin sa bawat wastong impormasyon na ating ibinabahagi, isang buhay po ang nasasagip at nailalayo sa peligro ng COVID-19. Sa usapin ng proteksyon at kaligtasan, lagi po tayong sumangguni sa mga eksperto at dalubhasa. Magtiwala po tayo sa kanilang dunong, sa busisi ng kanilang mga proseso, at sa siyensyang naninigurong ligtas ang lahat ng bakunang maihahatid sa bansa. Sama-sama po tayo magtiwala sa halaga ng bakuna at sa halaga ng minimum public health standards bilang instrumento kontra COVID-19. So tuloy-tuloy lang po tayo na magtulungan so that we can prevent further increases in the number of cases and we can be able na magkaroon po tayo ng maayos at successful na vaccination program dito po sa ating bansa. Maraming salamat po sa inyo and we will see all of you on Wednesday. Thank you, Nick.
Maraming salamat po.